Greetings, I am Chloe Henderson, a PGY1 pharmacy resident with the Xavier University of Louisiana College of Pharmacy, and I am proud to be able to present my research on the impact of post-MI depression on cardiovascular-related hospitalizations here at the Xavier University of Louisiana Health Disparities Conference 2023. The objective of the study is to compare the occurrence of cardiovascular-related readmissions in post-MI patients diagnosed with depression versus post-MI patients not diagnosed with depression. My hypothesis is that patients who are diagnosed with depression within a year after MI are at a greater risk for subsequent cardiovascular-related hospitalizations than those who are not diagnosed with depression within a year. The goals of this study include to identify a need for depression screenings in post-MI patients, identify any health disparities relating to depression screenings as a part of post-MI care, as well as identify any population trends in post-MI depression. My hope is that this study will contribute to literature by providing further evidence that there is a benefit in screening for and treating depression as needed on cardiovascular outcomes. This will be a retrospective cohort study utilizing data from the University Medical Center of New Orleans and the Ochsner Medical Centers. The study will look at adult post-MI patients aged 18 years of age and older who experienced a new onset acute MI between January 2014 and December 2021. Key exclusion criteria include a history of major depressive disorder, a history of MI, use of antidepressants, or pregnant or breastfeeding at baseline. This is a flowchart of the overview of the methods. At baseline, the total study population will have met the inclusion and exclusion criteria as previously described. The hope is that between data from UMC and Ochsner, the study population will be at least 100 patients. Within a year post-MI, groups 1 and 2 will have been identified, with group 1 having a diagnosis of depression within a year and group 2 not having a diagnosis of depression within a year. Within 2 years post-MI, the primary and secondary outcomes will be assessed. The primary outcome being cardiovascular-related hospitalizations. Of note, the cardiovascular-related hospitalizations must have occurred after the diagnosis of depression in group 1. Secondary outcomes include cardiovascular-related death and number of patients with recorded depression screening. The methods for extracting the data are as follows. First, the post-MI depressed group will be identified to guide the total study population. Because screening for depression is not a standard of post-MI care, it is expected that the post-MI depressed group will be a smaller cohort than those not diagnosed with depression. This will minimize the anticipated risk of skewed data between the groups. They will then be matched to a non-depressed post-MI patient by age, sex, race, presence of hypertension, type 2 diabetes, and/or dyslipidemia, as well as smoking status. Between the groups, the primary and secondary outcomes will be assessed. This table highlights the data sets that will be collected at baseline within a year post-MI, as well as within 2 years post-MI. Both the primary outcome of subsequent cardiovascular-related hospitalization within 2 years post-MI and the secondary outcome of cardiovascular-related death within 2 years post-MI will be analyzed using the Fisher's exact test to establish odds ratio. The secondary outcome of screenings for depression will be analyzed using descriptive statistics. Some anticipated results of the study include a higher incidence of cardiovascular-related hospitalizations in post-MI patients diagnosed with depression within a year post-MI, a higher trend of post-MI depression in women, as well as further evidence that routine depression screenings should occur after patients experience an acute MI to prevent subsequent cardiovascular-related hospitalizations and death. If the data supports, the anticipated discussion will further emphasize the importance of mental health screenings, specifically depression screenings, in post-MI patients for benefit on cardiovascular outcomes. Some anticipated limitations are secondary to the retrospective nature of the trial and the inability to control for certain variables, confounding factors that could have also contributed to the onset of subsequent hospitalizations or death, for example, non-adherence, a small cohort due to reported prevalence of post-MI depression and depression screenings not being a standard of post-MI care, as well as a lack of evidence that the depression was adequately treated. I would like to take the time to acknowledge my research team as listed. And this concludes my presentation. Thank you.